Hey everyone, this is Virginia White. This is my video for a journal discussion for week 1. So going back through the assignments, or looking ahead through the assignments for the course, I'm hopeful that my research will show that by placing a nurse practitioner in the triage setting, that the patient will have access to an immediate medical screening exam, which is incredibly important due to the high wait times in emergency rooms, as well as the increasing acuity of the patients, the excessive number of patients who walk in through the emergency room doors, the decrease in staff, and just the lack of resources these patients have. Having a nurse practitioner in triage would allow for an immediate medical screening exam, a decrease in their length of stay potentially. It would allow for possible early disposition of the patient, a decrease in the length of time from the patient arriving to analgesia, even allowing a nurse practitioner in triage could help capture those critically ill patients that may be overlooked initially. By having that medical screening exam, we could really help the patients and increase or decrease their mortality risk. Patients would have a better experience in the emergency room. Their needs would be met faster, as one would expect entering an emergency room. I think that not only just by talking to the patients after their visit, but even having a survey that they could fill out would prove the effectiveness of having a nurse practitioner in triage. We could also just look at the numbers, look at the length of stay, look at the times, the arrival times to the medical screening exam, how long that took for the patients to have that, the time from the medical screening exam to the orders, the time from the medical screening exam to the time the patients got pain medicine. So these are relatively simple ways of gathering information to prove that placing a nurse practitioner in triage is effective. So in looking through the course ahead, the assignments coincide with the project that we're doing, although I'm fearful that I may not be doing enough, or that I may be doing too much, or that I simply just don't know what I'm doing it wrong. But I do feel like the assignment, that as a whole, this course is allowing us to put everything we've learned together, and better to give us a better understanding of what the research part does in a nurse practitioner program. Most of us have been together for the past 2 years. I think we really work well together. We communicate well together. As far as my skills, I kind of feel like I may be sometimes a little bossy, sometimes I kind of take charge too soon, but I think that has to do with my emergency background and being a charge nurse in the ER. But I do feel like I have excellent leadership skills, and I will use them to my advantage for this class, as well as for my future. So I think that's about it. Thanks.